Now, who are these people that needs to be assessed for steatorrhea? Steatorrhea means there's a lot of fats in the stool. And you remember about that, that this stool is smelly, very odorful. They're large, meaning there's a lot of poops that will come out, and the color of that stool is gray, right? So that's how your steatorrhea looks like. So what causes steatorrhea? One of the reasons why you have steatorrhea, because you might have what we call pancreatitis, all right? So let's make a drawing because nursing is an art, okay? So if this is your pancreas, and this is your gallbladder in your liver right there, okay? And we have what we call common bile duct, all right? And we have your duodenal area, so that's how it looks like, all right? The common bile duct is where the enzymes will go and the bile will pass through. So that's how important this common bile duct, because it can release, or that is where those biles goes down to the duodenum area, and the lipase and amylase and protease into the small intestine. And that will absorb your vitamin A, D, E, K. All right? So what happens if you have pancreatitis? Your common bile duct will become inflamed and it will close because they are inflamed, right? Or maybe you have a stone in the gallbladder that blocks it. So what will happen if there is a stone in the gallbladder that blocks the common bile duct? There is no color in your stool. So now the stool becomes gray, because what makes the color of your stool golden brown, it's because of the bile. All right? So bile and enzymes, pancreatic enzymes, are the ones that absorb, that digest fats. Now, if you cannot digest fat, the vitamin addict will not be absorbed because we blocked it. All right. So what happens if there is no fat digestion, no absorption of vitamin addict? So what will be the complication of no absorption? So the no absorption will cause a problem called blindness. Vitamin A, you don't absorb vitamin A, blindness at night, right? What will happen if you don't have absorption of vitamin D? It will decrease the amount of calcium. And what will happen if you have no calcium? Tetany and seizure, which is also dangerous, right? What about if you don't have vitamin E? Vitamin E is more of immune system, but immune system problem is not necessarily causing a problem right now. It takes a while before your immune system goes down. All right. Decreased immune system. What about vitamin K? This is the worst one because this will lead into bleeding in your patient. All right. So remember, this patient will now suffer from bleeding. Right? Okay, will cause bleeding. All right. This is lack of vitamin K. Don't forget, vitamin K is different from K. All right. K is potassium. Vitamin K will prevent bleeding. Okay. So imagine if you have pancreatitis as well as gallbladder stone that causes the problem and blockage in your common bile duct, you will become blind. You will become problems of tetany and seizures. You will have a problem of decreased immune system. But the worst one that you have to remember in your NCLEX exam, the number one problem you look for is bleeding. Number two problems that you look for is your seizure. Number three problems they're gonna look for is number number three, and that will be your blindness at night. The last one that you will be working on will be monitoring the immune system of your patient. All right, so imagine just like that. But here's the thing, what else can cause this problem? Okay, so what else can cause this particular problem? Vitamin addict will not be absorbed because you're taking anti-cholesterol. It can be caused also by anti-obesity medication. So anti-cholesterol is statins, all right? Anti-obesity, these are your ally or orlistat. So if you are wasting or removing your oil in your body, this vitamin addict will not be absorbed. That's why some questions in your NCLEX exam. So what if I'm taking statin? What's gonna happen? Well, you will not absorb your vitamin addict because you lose your fats. You removed it. So what should I do? You have to take multivitamins every single day. Opposite to the intake of your medication. So if you take statins in the morning, you're gonna take your multivitamins at night. All right. If you're taking it at night, you're going to take your multivitamins in the morning. So at least there is a replacement of the missing vitamin addict. But however, it's still a question because what you don't have fats to digest the vitamin addict. All right. Just remember, in general, any anti-cholesterol can lead into bleeding. Any anti-obesity can lead into bleeding. So what are the things that will you monitor for bleeding? Petechial rash. All right. What else? What is the uh, black hematoma or anything? Hematoma or maybe gum bleeding. All right. So you have to monitor everything about manifestations of, of bleeding. It could be petechial rash. Petechial rash, when you stretch your skin, there's a lot of tiny dots of red dots. That is your petechial rash. Okay. So that's how important this informations for your NCLEX exam. All right. So you will just not be thinking of, oh, what should I do? But that's what you're going to do. All right, just for that particular discussion, there's a lot of complications already, and they are favorite in your NCLEX exam. And the best answer all the time is bleeding, bleeding, bleeding. Because bleeding is more important. But otherwise, your second portion is always seizure problem. Any questions on that particular favorite questions in your NCLEX exam? That's a